Hi, I'm Sue from Movement for Life, and today I want to talk about back pain. So I'm not talking about sciatica, I'm talking about the typical pain where you've done something silly, you've leant over, you've just brushed your teeth, you've bent down to do up your shoelace, and you feel your back go. You are kind of exercising, so you don't normally understand how all of a sudden your back has gone. So how can Pilates help, and how can you maybe recover sooner? So basically I want you to think of two ways of looking at the pain. You need to decide whether things like brushing your teeth causes more pain or less pain. Likewise, if you are sitting on a toilet seat, does as you sit and as you stand cause more pain or less pain? So the reason why I ask these questions is this will basically determine where your body wants to be when you are exercising. So if we look at one of the positions, which is basically brushing your teeth, as you brush your teeth, you're slightly hinging backwards and the back is round. So if the back feels really, really nice, this is the shape that you want to be exercising in. So the following shapes that you want to consider gently starting to move in is anything in 4-point kneeling. So you're going to come to 4-point kneeling. Hands in line with the shoulders, knees in line with the hips. And from there, you're going to draw the belly button in and you're slightly rounding and tucking the pelvis. So I currently don't have any back pain, so I know my range is going to be pretty good. If you are in discomfort and this kind of feels good and then all of a sudden it doesn't, then that's your range. You never want to be pushing into any pain or any more excessive stress or discomfort that the back already has. So for you, that stretch may be absolutely minuscule. From there, you're going to round the back as much as you don't get any discomfort, and from there you're going to slightly rock backwards, maintain that C-shaped curve and slightly rock forwards. Keep doing these little rockings forwards and backwards. You only want to be going as far as the spine feels comfortable. If by any chance it does feel okay, then rock back a little bit further. But any pain, any discomfort, just decrease your range again. From there, we're going to add to the stretch, and you're going to take one hand in front or on top of the other hand. From there, slightly rock backwards. Now, you're looking for a stretch down one side of the back. If this feels good, by all means, lengthen out that front hand and you'll increase the stretch. If it doesn't feel good, just come out of it, swap, and try the other side. So one hand on the other, maintain that C-shaped curve and slowly start to rock backwards. Once again, the pain or the discomfort may be less or more on the other side. Keep rocking backwards. If it feels okay and it feels like it's been stretched and it feels nice, slowly increase the stretch by moving your hand forwards. If there's any discomfort, then come out of the stretch. From there, we're going to rock back into child's pose, maintain the C-shaped curve, and gently rock back down until your bum hits your ankles. Elbows on the ground, and just rest the head towards the floor. So, this is what I call my Pink Panther posture and position. The other alternate position that may be very helpful is, of course, our Donald Duck position. So the example that I gave is something like sitting on a toilet seat. So if you start to sit backwards and your bum is out and it feels nicely lengthened and long, then perhaps the exercise that you want to try and focus on is what they call the dorsal stretch, cobra, or the Mackenzie stretch. So lying down on your tummy, you're going to have long legs. From there, hands are either side of your ears, and you're going to gently just lift the head. Make sure your lower abdominals are engaged, so your tummy muscles are up off the floor, and slowly just lengthen the chest away from the floor. It's not about height, it's about length. Once again, if you have discomfort, which I don't, your range may be very, very small. But you keep doing these every single day until gradually you can slowly increase the angle. How far up you come is entirely dependent on how that lower back feels. So from there, Once again, so these are your two movements, either what I call my Donald Duck position or my Pink Panther. Whatever causes discomfort, don't do. Immediately after I've irritated my lower back, this is the position I want to be in. I want to be lying flat down by a bed or by a chair, and I'm going to take my legs up and over onto the ball. 90 degrees. The reason being is that if the legs are long on the ground or even bent, there's still pressure on the lower back. By lifting them and taking them to 90 degrees allows the lower back and any torsion or stress in the lower back muscles to completely relax. From here you can do the following mini little tucks. So you're going to draw the belly button in and slowly start to articulate in the lower back. Once again, if you have lower back pain, and the movements may be absolutely minuscule. So you want to spend at least 10 minutes just lying flat on your back. If you're on your bed, then make sure that you have a pillow or anything that can create that 90-degree angle. So from there, keep doing your pelvic tucks. Every time, try and go a little higher. As long as there's no pain or discomfort on the way up or on the way down, you can keep doing those pelvic tucks. If there's any discomfort coming down or going up, then decrease your range. So, whether you do something or whether you do nothing, probably the recovery time is about the same. All I'm saying is that, speaking from experience, the idea of keeping moving definitely helps. So, to summarize, in case you ever get lower back pain, this would be my survival strategy. Take the legs to 90 degrees, try and rest as much as possible, and allow the lower back to kind of decompress and allow the muscles to relax. Decide in your mind whether what causes the pain. Is it being in a round shape or being in an arced shape? So Pink Panther or Donald Duck, if you can visualize those two postures. Try and do some gentle movements around those two shapes. From there you can add on and you can do some gentle stretches. So you can drop the legs from side to side, just allowing the back to slightly move from side to side, so it just warms up the lower back. You can also add a gentle stretch, so you're going to draw the knee towards your chest. You can also send that leg up, making sure, once again, it doesn't pull into the lower back. You can stretch out the glute and do the same thing on the other side. Draw the knee towards your chest, extend, lift the leg. Feel the stretch in the back of the leg. You don't want any pulling in the lower back. Stretch out in the glute. And from there you can also draw the knees towards your chest, lengthen the arms away, draw the knees onto the chest and lengthen away. So gently doing these every single day. You don't have to do them for long periods of time, but keep alternating between resting and a little bit of mobility will help, hopefully help speed up the lower back discomfort and will get you looking and moving and feeling great to get back to doing what you love, what you absolutely love to do. So good luck and let me know how it works for you, and thanks for watching.